Hey everyone, and welcome to another deep dive.
Yeah. Hey, everybody.
Today we're going to be diving deep into the world of liver cirrhosis.
A very important topic.
Absolutely. And we actually chose this one because this is something that our listeners specifically requested.
That's right.
So if you are a nursing student listening to this, this one is for you.
Yeah, this is going to help you.
But it's also important if
Yeah.
you're just interested in learning more about liver cirrhosis.
Absolutely.
So we have a couple of great resources
Yes, we do.
to help us break down this topic and really kind of get to the nitty-gritty.
Yeah. Get into the details here.
So we're going to be pulling from a couple of different sources to give you guys a really well-rounded understanding of this condition. So let's just jump right in.
Let's do it.
So the liver, I feel like sometimes it's like the unsung hero.
Kinda, yeah. It does so many things behind the scenes, right?
It really does. It's quietly working.
Yeah, it is.
It's got like a big to-do list.
It does a lot.
Yeah.
And we don't even think about it.
We don't.
Until there's a problem.
Exactly. So when it starts to have problems, though, it can really impact the entire body.
Absolutely.
So before we get into the signs and symptoms of liver cirrhosis, let's just kind of level set and talk about what is liver cirrhosis.
Okay.
Like what's actually happening in the body
Good point.
when someone has this condition.
What is going on?
Yeah, and I thought this was really interesting. One of the sources kind of used this mnemonic device.
Yeah, I like those.
Liver sclerosis.
Oh, okay.
And it essentially just kind of means that healthy liver tissue gets replaced by scar tissue.
So that scarring here's really the problem.
So it becomes hard.
Right. It gets hard.
And it can't function properly.
It can't do its job.
Right.
And its job is to filter the blood, essentially.
Right. Yes. Exactly. All of the blood from the digestive system has to go through the liver, and the liver cleans it up.
It's like a big filter.
It is like a big filter.
So that's a really good visual, I think, for understanding what's happening. So we have the scarring.
Yeah.
What kinds of things can lead to this?
Oh, so many things.
Yeah.
But I guess we could simplify it by saying most of them are chronic conditions, right?
Correct.
So long-standing problems.
So like what?
Things like alcohol abuse.
Okay.
Chronic hepatitis. And, cystic fibrosis can even contribute.
Cystic fibrosis. Yeah. I know that one seems a little out of left field, but But if you think about it, it makes sense because in cystic fibrosis, right, you have this thick, sticky mucus that builds up everywhere.
Including the liver.
Right. And over time, that can cause some damage.
Oh, okay.
And blockages. And that can lead to scarring.
Okay. So the mucus itself isn't direct
scarring, but it's causing
problems.
It's causing enough problems to
that then leads.
Yeah. And eventually you end up with cirrhosis.
Okay, that makes sense.
Yeah.
So we've got this scarred liver that can't function properly.
It can't do its job.
So then what does that actually look like for the patient?
That's a good question.
Like what signs and symptoms should we as nurses be looking out for?
Okay, so let's start with one of the most noticeable ones.
Okay.
Jaundice.
Jaundice.
Right, so remember how the liver normally helps to remove bilirubin from the body?
Right.
That's the yellowish substance.
That comes from the breakdown.
Right, comes from the breakdown of red blood cells.
Of red blood cells, yeah.
And one of the sources had this really cute analogy.
Oh, yeah.
The bile bus.
The bile bus, yeah.
Right, so think of bile as like a bus that picks up the bilirubin and carries it out of the body.
Okay.
But with cirrhosis, that bus route gets all messed up and bilirubin starts to build up in the blood.
And that's what causes...
And that's what causes that yellowing of the skin and the whites of the eyes.
The jaundice.
The jaundice, exactly.
Interesting.
Yeah.
Okay, so then another thing I know that you see a lot with liver cirrhosis is...
Ascites.
Ascites.
Right.
And that's that fluid buildup.
Yeah, fluid buildup in the abdomen.
In the abdomen.
Yeah, so, normally the liver produces a protein called albumin.
Right. And
albumin plays a key role in regulating fluid balance.
So in one of the sources it said, it's like albumin attracts water.
Yes.
Drugs.
Yes.
And binds with calcium.
Yes, that's a great way to remember.
AAA.
The AAA.
That was a good mnemonic device.
Yeah, I like that one.
Okay. Yeah. So it acts like a magnet for water.
Exactly.
So when the liver is damaged,
and
it can't produce enough albumin,
you're
going to have all that fluid kind of...
It's going to leak out.
Leaking out.
Yeah.
Into places where it shouldn't be.
Third spacing.
There it is, yeah.
That's the term.
That's the fancy term.
Okay, so low albumin.
Low albumin.
Equals fluid shifts.
Fluid shifts.
Right, ascites.
Ascites.
Okay, so basically...
Swollen belly.
Yeah, swollen belly.
Okay.
Big time.
Got it.
Yeah.
Okay, so we've got jaundice. We've got ascites.
Uh-huh.
Anything else?
Oh, yeah, there's more.
That we should be aware of?
So remember how we talked about the liver being like a filter?
Right.
When it gets all scarred and hardied?
Mm-hmm.
The blood flow gets backed up.
Okay.
Especially in the portal vein.
And the portal vein is?
Oh, it's the main vein that collects blood from all the digestive organs and carries it to the liver to be processed.
Got it.
So when the liver is cirrhotic, it's like a traffic jam in the portal vein.
Okay.
And that increased pressure in the portal vein, that's what we call portal hypertension.
Okay, so portal hypertension is basically like?
High blood pressure.
High blood pressure.
Yeah.
In the portal vein.
In the portal vein, exactly.
Okay.
Because the liver is acting like a roadblock.
It all makes sense now.
Yeah, so that all kind of connects.
Yeah.
Right. Okay, so...
Yeah, so that backed up blood flow can cause some pretty serious complications.
Okay, like what?
Well, one of the most concerning ones is esophageal varices.
Esophageal varices?
Yeah.
It sounds a little scary.
I know it sounds kind of intimidating, but essentially they're just enlarged veins in the esophagus.
Okay.
So think of it like varicose veins, but in a much more delicate
and dangerous
location.
Okay.
Right?
Yeah.
So all that backed up blood from the portal hypertension, it puts a lot of pressure on those veins.
Okay.
And they can rupture, which can lead to massive internal bleeding.
Wow.
One of the sources even described it as a ticking time bomb.
Oh, wow.
Which I think is a pretty accurate description. Yeah. So as nurses, we need to be really careful with these patients when it comes to anything that could increase that pressure.
Increase the pressure?
In those veins.
Exactly. You know, so things like...
What are they?
The Valsalva maneuver.
Valsalva maneuver.
Yeah. You know when people like strain or hold their breath?
Okay.
When they're lifting something heavy?
Or even like...
Or even straining during a bowel movement.
During a bowel movement.
Right.
Yeah.
All of that increases pressure in the abdomen.
Okay.
Which in turn increases the pressure on those esophageal varices.
I see.
So it's like squeezing a balloon, right? The more you squeeze...
The more pressure?
The more likely it is to burst.
Got it. Okay, so no heavy lifting?
No heavy lifting.
No straining.
And encourage those bowel movements. Nice and easy.
Absolutely.
Yeah.
Okay, so now let's talk about another...
Complication,
yeah.
Of cirrhosis.
That we need to be aware of.
Yes.
Hepatic encephalopathy.
Hepatic encephalopathy.
Yes.
That's a mouthful.
So that's the one that's like the cloudy brain.
The cloudy brain. That's a good way to think about it.
Yeah.
Yeah, and it all comes back to that ammonia buildup.
Right, because the liver normally...
detoxifies ammonia.
Detoxifies it.
Which is a byproduct of protein breakdown.
Right.
But when the liver is failing... it can't do that effectively.
Okay.
And ammonia starts to build up in the bloodstream.
And it likes to go to the brain.
And the brain seems to be its favorite hangout spot.
I see so.
Yeah.
What does that look like, though?
Well, one of the earliest signs is a change in mental status.
Okay.
So you might see confusion, disorientation.
Okay.
Maybe even some personality changes.
Yeah.
As the ammonia levels rise, patients can become drowsy.
Okay.
Lethargic. And eventually, they can even become comatose.
So it can get really serious.
It's progressive.
If it's not addressed.
If it's not caught and treated.
Yeah. Are there any, like, physical signs that we can look for?
Oh, yes, there are.
Besides just the mental status changes?
Yes. One of the classic signs is asterixis.
Asterixis.
Yeah, it's this flapping tremor of the hands.
Okay.
So you'll often see it when you ask the patient to extend their arms and hold their wrists up. It's almost like they're trying to flap their hands like birds. But it's involuntary.
Oh, interesting.
Yeah.
And then there's this other sign called fetor hepaticus.
Fetor hepaticus.
Yeah, I know it's another one of those fancy medical terms.
It is.
But it's basically a sweet, musty odor on the breath.
Okay.
That can be a sign of severe hepatic encephalopathy.
Okay.
But to be honest, you probably won't encounter that one very often.
Okay.
The mental status changes and asterixis, those are much more common and reliable signs.
So we've covered a lot of information.
Yeah.
Jaundice, ascites, esophageal varices, hepatic encephalopathy. It's a lot.
It's a lot.
Cool, and it's all connected.
It is.
Right, and that's why understanding the pathophysiology, the why and the how of these symptoms is so crucial for nurses.
It's not just about memorizing a list.
No, it's not about rote memorization.
It's signs and symptoms.
It's about understanding. Yeah, you got to connect the dots.
Why this is happening.
Absolutely.
So that you can provide the best care.
Exactly. Yeah. Okay. So now that we've talked about the what of cirrhosis, let's move on to the how do we actually care for these patients?
As nurses.
Yeah, what can we do to make a difference?
That's a great question.
Well, stay tuned for part 2, where we're going to dive into the world of nursing interventions and treatments for cirrhosis.
Looking forward to it.
Yeah, me too. This is going to be good. All right, so let's talk about what we as nurses can actually do to help our patients with cirrhosis.
Okay. Because it's one thing to know the signs and symptoms, but it's another thing to actually put that knowledge into action.
Exactly. So let's start by talking about managing those complications we discussed earlier, like ascites.
Right, the fluid buildup.
Yeah, and one common procedure for that is called a paracentesis.
Okay. Paracentesis. I've heard that term before. Can you just remind me what exactly that is?
Sure. So basically, a needle is inserted into the abdomen to drain that excess fluid.
Okay. That makes sense. And it helps relieve that discomfort and pressure from the ascites.
Exactly.
Okay. Are there any, nursing considerations that we need to be aware of when a patient's having a paracentesis?
Oh, absolutely. So before the procedure, it's super important to make sure that the patient empties their bladder.
Okay.
Because we don't want to accidentally puncture the bladder.
Right, of course.
And positioning is important, too. They should be sitting upright, usually in high Fowlers during the procedure.
Okay.
And, of course, monitoring their vital signs throughout the procedure.
Okay, all very important things.
Yes.
So we've addressed the fluid buildup with paracentesis.
Mm-hmm.
What about diet modifications?
Oh, yeah. Diet is huge when it comes to managing cirrhosis.
Okay, so what kind of things are we looking at?
Well, one of the most important things is restricting protein intake.
Okay, and why is that?
Remember how we talked about ammonia buildup and hepatic encephalopathy?
Yes.
Well, protein breaks down into ammonia.
Oh, right.
So by reducing protein in the diet, we can help minimize that buildup and protect the brain.
Less protein equals less ammonia, which equals a clearer brain.
Exactly.
Got it. What other dietary changes are usually recommended?
Well, since we're also trying to manage the fluid buildup, restricting sodium and overall fluid intake is often necessary.
Okay, so low protein, low sodium, low fluid sounds like a pretty restricted diet.
It can be, but it's really important for managing those complications and preventing further damage to the liver.
Right, and of course no alcohol.
Oh, absolutely. Alcohol is definitely off the table.
Regardless of what caused the cirrhosis.
Right, exactly.
Okay, so we've got diet covered. What about medications? Are there any specific drugs that we should be familiar with as nurses?
One that comes up a lot is lactulose.
Lactulose.
Yeah, it's a medication that helps remove ammonia from the body.
Oh, right, because that helps with the hepatic encephalopathy.
Exactly.
Okay, are there any side effects that we need to be aware of?
One thing to watch for is hypokalemia.
Which is?
Low potassium.
Low potassium, okay.
Yeah, lactulose can cause potassium loss through the bowels, so monitoring those potassium levels is really important.
Okay, so we're fixing one problem, but we need to make sure we're not creating another.
Exactly. It's all about balance.
What about albumin? I know that's given sometimes intravenously.
Yeah, albumin 5E can help increase blood pressure.
Okay.
But it's really important to monitor those vital signs closely.
Okay, looking for a sudden increase in blood pressure.
Yeah, or a bounding pulse.
Got it. So we're watching for signs that it's working, but also being careful that it's not causing any adverse effects. Now, what about those esophageal varices? What can we do to prevent them from rupturing?
Well, preventing rupture is a top priority. And one key thing is to avoid anything that increases that abdominal pressure, like the Valsalva maneuver.
Right, no straining, no heavy lifting.
Exactly. And medications called beta blockers are often prescribed to lower blood pressure in the portal vein.
Okay.
Which in turn reduces the pressure on those varices.
So it's kind of like reducing that traffic jam.
Exactly.
In the portal vein.
Yeah, good analogy.
But what if they do rupture? What happens then?
Well, that's an emergency situation that requires immediate intervention.
Okay.
And treatments can range from medications to stop the bleeding to procedures like endoscopic banding, where they basically use a tiny band to tie off the bleeding varices.
Wow, that sounds pretty intense.
It can be, but we have skilled specialists who can handle those situations.
That's good to know.
So we've covered paracentesis, diet modifications, lactulose, albumin, beta blockers. Is there anything else we should be thinking about as nurses?
What about pruritus? That itchy skin that I know can be a problem.
Oh, yeah, pruritus. That's a common problem in cirrhosis, and it can be really frustrating for patients.
I can imagine itchy skin is never fun, but when you're already dealing with so much else, it must be even worse.
Exactly, and the exact cause isn't fully understood, but it's thought to be related to the buildup of bile salts in the skin.
Okay, so is there anything we can do to help?
Well, there are a few things that can provide some relief, like applying cool compresses and moisturizers.
So,
Wearing loose-fitting, breathable clothing can help reduce irritation. And for some patients, medications like antihistamines or clostiramine might be prescribed.
okay, so there are options for managing that itching.
Yeah, definitely.
What about pain management? I imagine cirrhosis can be pretty painful.
You're right. Pain is another important consideration, and we need to assess and manage it carefully, using medications as needed, but also being mindful of potential drug interactions.
Right. And the liver's ability to even process those medications.
Exactly. It's about finding that balance. And remember, pain isn't always physical.
True.
Cirrhosis can take a huge emotional toll on patients, so it's important to address those psychological and emotional needs as well.
Absolutely. It's about treating the whole person.
Exactly.
Speaking of treating the whole person,
Yeah.
let's talk about those lab values.
Ah, yes. Lab values. Those are like clues that help us understand what's going on inside the body and how the liver is functioning.
I'm ready to put on my detective hat. What are the key ones that we should be paying attention to?
Well, we've already talked about some of them, bilirubin, albumin, potassium, but there are a few others that are important indicators of liver function and coagulation status.
Okay, lay it on me.
So besides elevated bilirubin, which, remember, indicates that bile bus breakdown we talked about,
Right.
we'd also expect to see elevated liver enzymes like ALT and AST.
And those are elevated because...
They're released into the bloodstream when liver cells are damaged, so elevated levels are a sign of liver injury.
Oh.
And we also need to keep a close eye on those clotting factors.
Right, because low clotting factors mean higher risk of bleeding.
Exactly, and there are specific tests that measure clotting ability.
Okay, like what?
The prothrombin time, PT, the INR, and the PTT.
Okay.
These values are going to be elevated in cirrhosis, indicating that higher risk of bleeding.
So elevated bilirubin, liver enzymes, and clotting times.
Yeah.
What about anything that might be low?
Well, besides low albumin, we often see low platelet counts in cirrhosis.
Because platelets are important for...
blood clotting.
Right, so low platelets further increase that bleeding risk.
It's like a double whammy.
Wow, so many lab values to keep track of.
I know it's a lot, but it's amazing how much information we can get from a simple blood test.
Yeah, it really is. It's like a window into what's happening in the body.
It is. And speaking of windows, we've covered a lot of ground in this deep dive, but there's one more crucial aspect of cirrhosis that we need to address.
Okay, so we've talked about all the physical stuff, the lab values, all the interventions, but there's another layer to this whole thing, right?
Absolutely. Cirrhosis isn't just a physical condition.
Yeah.
It affects the whole person, their life emotionally, socially, even financially.
Right. It's going to be incredibly stressful dealing with all those symptoms.
Oh, absolutely. The fatigue, the discomfort, the worry about potential complications, and then there's the stigma.
Oh, yeah.
That often comes with liver disease, especially if it's related to alcohol use.
Right.
People might feel shamed or embarrassed to talk about it.
And that makes it even harder to cope and ask for help.
Exactly. And that's where we, as nurses, can really make a difference.
So how do we do that?
Well, it starts with compassion and empathy.
Of course.
A non-judgmental attitude, creating that safe space for patients to share their fears and concerns.
Just letting them know they're not alone.
Exactly. And we can also connect them with resources.
Like what kind of resources?
Social workers, therapists, support groups, people who can help them navigate all the challenges that come with cirrhosis.
Right, because it's not just about the physical stuff.
It's not. It's about the whole person, their mental health, their emotional well-being.
What about family support?
Oh, that's crucial. Cirrhosis affects the whole family.
It does.
Loved ones are going through their own stuff, too. They might be scared, worried.
Right.
They need information and support to understand what's happening and how to help.
So it's about caring for the whole family unit.
It is. And remember, as nurses, we're often the first line of support for both the patient and their family.
We are.
We're the ones answering questions, providing education, offering a listening ear.
That's a big responsibility.
It is, but it's also a privilege.
It is.
And it all comes back to that holistic approach. Treating the whole person, not just the disease.
Well, I think we've done a pretty good job.
I think so, too.
Of covering all that in this deep dive.
Yeah, we've gone from the liver's function to the complexities of cirrhosis.
All those lab values.
All the interventions.
The importance of that human connection.
Absolutely.
Wow, it's been an incredible journey.
It has, and this is just the beginning.
It is?
There's always more to learn.
Always.
And the more we know, the better prepared we'll be to care for our patients.
Couldn't have said it better myself. A huge thank you to all our listeners for joining us on this deep dive into the world of liver cirrhosis.
Keep learning, keep asking questions, and keep striving to be the best nurses you can be.